Trachoma is a bacterial infection that damages the cornea of the eye and is commonly found in Africa, Central and South America, Asia, and Australia. Morocco is a country in Africa that's been fighting this disease since 1953 when the Ministry of Health, the WHO, and the UN National Children's Fund trained medical and nursing staff to service the poorest countries. In 1992, a national survey was conducted only to find out that just over 5% of Morocco's population suffered from the disease, and nearly all of the cases could be found in 5 southeast rural provinces. In those 5 rural provinces, 25,000 people displayed a decline in vision from the disease, 625 people needed immediate treatment for inflammatory trachoma, and approximately 40,000 people needed immediate surgery. Trachoma is the second leading cause of blindness and the leading cause of preventable blindness. It affects 55 countries and infecting 84 million people due to its economic development and proper sanitation. It affects 55 countries, infecting 84 million people due to its economic development and poor sanitation. Countries like North America and Europe are not affected by this disease. However, this disease is very prominent in countries that are located in hot, dry regions, with limited access to clean water, lack of sanitation, and reduced access to healthcare services.
Good morning.
Morning.
What brings you here today?
Well, my eyes are feeling very red and swollen and itchy lately. I can't do the days that I usually do. It's to a point where like every time like I blink, I feel like a watery sensation and something like in my eye. It's hard to drive, it's hard to eat, it's hard to get myself dressed, so I don't know what's happening to it.
Okay, let's take a look here. Why don't you move your eye to this side, down. Do you still feel pain and irritation?
Yes, I
Is it
feel
watery?
very prickly with watery sensation.
Oh my, okay, I see what's happening. Seems that you've contracted a bacterium called chlamydia trachomitis. That is a root cause to many different diseases. One of those diseases is called trachoma. But however, not all strands of chlamydia trachomitis causes trachoma. It's just the strands of A, B, and C bacteria result in trachoma. But you have nothing to worry about. You came just in time. But most of the times, if you are delayed in treatment, trachoma can cause blindness because multiple occurrence or not being treated, it scars your top of your eyelid, which prevents you from blinking up and down. And this is mostly seen in developing nations, not so much in developed nations, which is kind of confusing for me. Did you go traveling anywhere recently?
Well, that's why actually, I live in Canada. I'm very hygienic and very clean. I thought this only happened in low income or like nations or like people who live with hot weather. I don't understand why I would live in Canada, but I did go to Africa for 3 months, so maybe that was the cause of it.
Well, that explains everything, Trinelle, don't worry. So places like developing nations like Africa, it seems as though they're very low on resources when it comes to medical attention, and they don't have much knowledge on hygiene or hygienic properties because they're not very, as I mentioned, their resources are really low. And trachoma is most likely to occur in crowded areas, which is places like Africa, unclean water, because you're washing your face in unclean water, you can easily contract these diseases. And through flies. There's a lot of flies, so one person can get trachoma, fly can infect them, sit on their eye, something like that, and then carry that infection to someone else. So that may have happened in your occurrence because there's many modes of transmission, as you're familiar with, indirect and direct modes. So it's easy that you got this infection from your trip from Africa. But you have nothing to worry about. We have more medical attention here than over there. And those are the cases that are most likely to be, more people that are likely to be blind.
So what treatment should I get for this?
The treatment that's very easy since you came on your early stages. You can do antibiotics. Antibiotics prescriptions on antibiotics will kill that bacteria. You should be fine in a couple days or a couple weeks, if anything. But in cases that your eyelids are scarred or deformed, there's always surgery available in Canada to get you back on track and make sure that you're not blind for the rest of your life.
Okay, well, thank you, doctor.
Thank you. See you again.
In 1991, Morocco developed the National Trachoma Control Program. The efforts of this program were supported by a number of partners, including the World Health Organization and a number of international non-governmental organizations. The Moroccan program for the elimination of trachoma-related blindness included 2 key strengths. The first one was to include eye health services to primary health care systems as a means of prevention. The second, and perhaps the most significant aspect of the program, was the implementation of the SAFE strategy. In further detail, the community-based SAFE strategy, implemented in 1997, was used to understand the underlying causes of the disease and the risks associated with blindness. In contrast to the previous approaches used to tackle trachoma, the SAFE strategy included the effect of behavioral and environmental changes. As previously stated before, SAFE stands for Surgery, Antibiotics, Facial Cleanliness, and Environment. Surgery refers to the need to interrupt further corneal damage and thus prevent the onset of blindness. The procedure provides a success rate of about 80% and costs $6 per person in low-income countries. Antibiotics, such as azithromycin, are also a very effective way in treating active trachoma infections, halting the spread of the infection as well as preventing scarring. Even though it provided benefits, compliance with these medications was often poor due to the time-intensive treatment and the side effects of stinging sensations and blurred vision. Facial cleanliness is also very important because it breaks the cycle of reinfection as well as preventing the spread of bacteria. Cleaning one's face, in addition to washing hands, can help remove the discharge from infected eyes. This is an important key factor, especially in low-income countries, because only a small amount of water is needed. For example, only 1 liter of water can clean as many as 30 faces. Environmental change involves the improvement of community hygiene to reduce transmission. This can include creating latrines to reduce flies that are associated with trachoma, as well as providing clean and adequate water in communities.
The overall impact of this program has allowed the prevalence of trachoma in children under 10 to be reduced by 99% since 1997. The result of this program provides evidence as to how significant hygiene and safe drinking water is in regards to health and the prevention of diseases. By the end of 2005, Morroco has achieved the epidemiological endpoints defined by WHO for the elimination of trachoma. Thank you for watching, and I hope you have learned about trachoma. For more information, you can visit WHO/trachoma.